If you're over 50, please learn from my mistake. I was 55 when it started. Not pain, just small things that didn't make sense. I'd walk into the kitchen and forget why I was there. I'd lose the simplest word I'd said 100 times before. Sometimes I'd tilt my head down to read my phone and feel a strange electric shock run down my spine. I told 3 different doctors. They all said the same thing. Your MRI is clear. You're probably just tired. It's normal at your age. So I believed them. I went home, and slowly, quietly, I kept getting worse. If someone had recognized what those early signs meant, I could have started treatment 2 years earlier. 2 years. That's not just time. That's your independence. Your life.
What she just described isn't rare. It's one of the most common and frustrating patterns in early multiple sclerosis. Someone notices something strange they can barely explain. They go to a doctor. They get a scan. But the scan comes back normal, and the clock keeps ticking, while something is quietly happening inside their nervous system that no standard MRI can yet detect. Here's what most people are never told. MS lesions don't always appear the moment the disease begins. Nerve inflammation and early signal disruption can be present for months, even years, before anything shows on a scan. That window between when the brain changes and when the MRI can see it is where the most important warning signs live. Today, we're going through 8 of those signs, not the textbook ones, but the harder-to-name experiences patients often recognize only in hindsight. You may have dismissed them as stress, age, or feeling tired. After today, you'll know what to watch for and what to say to a specialist. At the end, I'll give you the exact next steps to ask for so you're not dismissed again. If you wish to stay ahead of your investigations, subscribe so you don't miss this information. Number 8, the hot shower that steals your strength. You love a warm shower, but lately, by the time you step out, your legs feel like lead. Your vision is fuzzy and your brain feels staticky. Your grip is weak. You feel foggy in a way that's hard to describe. Then, 20 minutes later, you're completely fine again. If this sounds familiar, what you may have experienced is called Uthoff's phenomenon. In MS, your nerves lose their protective insulation. Heat, even a warm bath, scrambles the electrical signals. The result is a temporary worsening of symptoms that can last minutes to hours. When the body cools down, the signals recover. Age-related weakness doesn't just vanish when you cool down, but MS weakness does. That heat-specific pattern is a neurological fingerprint. If your strength returns the moment you cool down, it's not your muscles, it's your nerves. If warmth consistently triggers weakness, blurred vision, or confusion, and cool air reliably brings you back, that pattern deserves medical attention. Number 7, the yawn that travels down your spine. You look down at your phone. You lower your chin to your chest. And suddenly, a quick electric jolt runs from the back of your neck down your spine, into your arms, into your legs. It's gone in a second. This is called Lermite sign, one of the most specific early indicators of spinal cord involvement in MS. When you bend your neck forward, it can irritate exposed nerve fibers, sending a false electrical signal down the spinal cord. Here's why it gets missed. The sensation lasts only 1 to 2 seconds. It doesn't hurt. It doesn't linger. It just happens like a glitch in the system. If you've experienced this, even once, mention it to a neurologist. It's the kind of detail that can change the diagnostic picture. Number 6, the sound that hurts. The television is at a normal volume, but today it feels like it's drilling directly into your head. Or you're in a restaurant and the background chatter suddenly makes it impossible to follow a single conversation. Not because you can't hear, but because your brain can't filter. When auditory pathways in the brain are disrupted, ordinary sounds can feel amplified or overwhelming. A standard hearing test may come back normal because your ears are fine. It's the brain's ability to organize sound that's changed. People often say, "I can hear everything. I just can't make sense of it anymore." If sound has started to feel overwhelming without a clear cause, this is worth raising with a specialist. Number 5, the yawn that won't explain itself. This is one of the most misunderstood symptoms of all, not just tiredness, and not the kind that sleep fixes. MS fatigue can arrive suddenly. Even after a good night's sleep, a cup of coffee, or a quiet hour on the sofa. People describe it as like someone pulled a plug. A total system shut down. In MS, this fatigue may be caused by the extra neurological effort your brain uses to send signals through damaged pathways. Normal tiredness is like a battery running low. MS fatigue is more like a short circuit. If you're exhausted without a clear reason and rest doesn't fix it, the issue may not be your muscles. It may be your wiring. Sign 4, the sentence that disappears. You're mid-sentence. You know exactly what you're trying to say. The idea is completely clear, but the specific word you need, will not come. You circle around it. You describe it instead. You laugh it off. This is called word retrieval failure. And in early MS, it can appear long before any obvious cognitive change. It's different from the normal tip-of-the-tongue moment. It happens more often, with common words, not unusual ones, and in familiar conversations you know well. MS acts like a bad connection between the part of your brain that holds information and the part that speaks it. We all forget words as we age. But MS brain fog often gets worse with heat, stress, or fatigue. If your ability to speak comes and goes depending on your temperature or energy level, that's a signaling delay, not just a senior moment. Number 3, the invisible band around your chest. A tightening around your rib cage. A squeezing pressure, as if someone has wrapped a tight band around your chest or abdomen. No pain exactly, more like a vice, or a corset that's slightly too tight. Sometimes it's just one stripe across your torso. Sometimes it wraps all the way around. It can last seconds. It can last hours. It can feel like a muscle cramp, a digestive issue, or, frighteningly, the beginning of a cardiac event. This is sometimes called the MS hug, and despite the general name, it can be deeply alarming. This is caused by tiny spasms in the muscles between your ribs. It's one of the most misdiagnosed signs of MS because it feels like a heart or stomach issue. But those tests always come back clear. If you feel a recurring squeezing, that gets worse when you're stressed or hot. Don't just see a heart doctor. Tell a neurologist about the MS hug. It's not your heart. It's your nerves. Number 2, the bladder that doesn't wait. You need the bathroom. Not in a minute. Now. Urgently. With no warning. And when you go, sometimes very little comes. Or the opposite. The need to go frequently through the night, even when you haven't drunk much. Bladder changes are among the most common early MS experiences, and among the most commonly dismissed. Think of your bladder as a muscle that takes orders from your brain. When the wiring in your spine is damaged, those orders get garbled. It's easy to blame a UTI or menopause, and often that's exactly what it is. But if your bladder starts acting up at the same time you feel those electric zaps or that heat fatigue, it's a major red flag. Your bladder isn't the problem. The signal is, number 1, the eye that moves too fast. You glance across the room. Your eyes get there, but for a fraction of a second, they seem to overshoot. They jump past a point and then snap back. You might notice it when reading or during tasks that require focus. Your brain acts like a GPS for your eyes. When there is a glitch in the brainstem, your eyes lose their precision. You might not see it, but you'll feel it. Reading suddenly becomes exhausting because your eyes are struggling to stay on track. It's not a vision problem. It's a wiring problem. This is rarely tested in a standard GP appointment, but a neurologist who knows what to look for can identify it clearly, even before it's obvious. And this is where many people feel stuck, because you recognize these symptoms. You know something has changed, but your MRI comes back normal, and suddenly it feels like the conversation ends there. You're told to wait, to monitor, or worse, that it's stress, anxiety, or simply aging. So if this sounds like you, if your symptoms are progressing but your skin isn't showing anything, here are 3 specific next steps you can ask for that often change how seriously this is investigated. First, ask for an MRI with contrast. Early MS inflammation may not show on a standard scan, but contrast can highlight active areas of inflammation, even when the rest of the brain appears normal. Second, request imaging of your cervical and thoracic spine, not just the brain. In many early MS cases, especially in people over 50, the first lesions appear in the spinal cord, not the brain. A brain-only MRI can miss what's happening entirely. And third, ask your neurologist whether a lumbar puncture or evoked potential test is appropriate. These tests can detect immune activity and signal delays in your nervous system, even when the MRI looks completely clear. Because here's the truth. MS is not diagnosed by MRI alone. It's diagnosed by a pattern, your symptoms, your history, and how your nervous system responds to stress, heat, or fatigue over time. If your symptoms are progressing, but your scan isn't changing, then the scan may not be telling the full story. And you deserve to be investigated further before more damage becomes permanent. 8 signs. Most of us ignore them because they're subtle, and because a normal MRI makes you doubt your own body. But a clear scan doesn't always mean you're fine. If you recognize even 2 of these, don't walk away. Take notes. See a neurologist. Ask the full picture. Spine imaging, contrast, or a lumbar puncture. Because MS is a pattern, not a single snapshot. Push for the truth now, while you still have the power to protect your independence. Don't let one skin decide your future.